Thank you so much, Mr. Chairman. I want to thank the panel and welcome all of you. Many of you have appeared in front of my subcommittee, the Oversight and Investigation Subcommittee, a number of times. And just to let you know, the O&I subcommittee is going to be continuing its investigations, both about how we responded to this and where we go in the future. So you can expect to hear from us. I have some brief questions for each witness, and I'd like to start with you, Admiral Giroir. The chairman talked about the president's comments last weekend, saying that it's a double-edged sword testing, because when you do testing, quote, you're going to find more people. And then again this morning, the president tweeted, cases are going up in the U.S. because we are testing far more than any other country and ever expanding. With smaller testing, we would show further cases. This is what he says. And he also said this morning that he doesn't joke about these things. So I know the chairman asked Dr. Fauci and Dr. Redfield if they've been instructed to test less. I'm going to ask you, since you are now in charge of overseeing the tests, has the president asked you to do fewer tests?
Thank you. And again, I want to clarify that neither the
yes or no will work. Yes or no will work, Admiral. Has
no,
the president asked you
the president
to do
has
fewer tests?
Neither the president nor anyone in the administration has instructed or suggested that we should do less testing, have said that to me, and we are proceeding in just the opposite. We want to do more testing of higher quality.
I want to ask you, Admiral, do you think that it's a good or a bad idea to do less testing so it will look like we have fewer cases?
My purpose in leading is to increase the number of testing. The only way that we will be able to understand who has the disease, who is infected and can pass it, and to do appropriate contact tracing is to test appropriately, smartly, in as many people as we can.
Thank you so much. Dr. Fauci, I wanted to ask you, I've seen some data the last few days that while cases are going up in this country, deaths are going down. And I've seen some reporting in the media that in part that's because younger people who tend to not to die from COVID are the ones being infected. Should we see this as a positive sign, or should we still be worried?
I think it's too early to make that kind of link, Congresswoman. Let me explain. Deaths always lag considerably behind cases. You might remember that at the time that New York was in their worst situation, where the deaths were going up, and yet the cases were starting to go down. The deaths only came down multiple weeks later. So you're seeing more cases now while the deaths are going down. The concern is if those cases then infect people who wind up getting sick and go to the hospital, it is conceivable you may see the deaths going up. So I think it's too early to say because the deaths are going down.
Thank you, Doctor. And I have another question, Dr. Fauci, for you. We've seen, and I think you and I have talked about this, most vaccines take years, if not decades, to be approved and be proved efficacious. And sometimes we don't find a vaccine at all. I have two questions for you. Number one, do you believe that we will find a vaccine for the coronavirus? And number two, do you still stand by the prediction you gave us some months ago that we could actually have a vaccine by early 2021?
I feel cautiously optimistic, Congresswoman, that we will be successful in getting a vaccine. There's never a guarantee of that, but the early data that we're seeing regarding the immunogenicity and the induction of good responses makes me cautiously optimistic, always knowing that there's never a guarantee. You remember I told your committee a few months ago that a vaccine would be available from a year to 18 months. I said that in January of 2020. A year from January is December. I still think there is a reasonably good chance that by the very beginning of 2021, that if we're going to have a vaccine, that we will have it by then.
Thank you very much, Doctor. Mr. Chairman, I'll yield back.